Text neck. We've covered the topic in a previous video that you can check out below. But what can happen if it's not corrected? How long does it take to worsen? In this video, I'm going to show you the x-rays of an actual patient of ours who a year ago with some neck pain and she could not commit to care due to personal reasons. And now a little over a year and a half later, she came back in and I'm going to show you the before and after images and how her condition. Hi, my name is Dr. Frank Altenrath and I'm a chiropractor in Cresskill, New Jersey at Valley Optimal Spine. I've been a chiropractor now for 20 years and in my office we've helped hundreds and hundreds of people with chronic spinal conditions. We've helped people recover from chronic spinal conditions such as bulging discs in the neck, bulging discs in the low back, sciatica, pain down the legs, pain down the arms, numbness and tingling. We've helped people with headaches, neck pain, low back pain, and even things such as sports injuries and poor posture. If you're new to my channel, I'd like to invite you to subscribe down below and click that notification bell because each week we put out new content on how to relieve chronic pain, whether it's neck pain, low back pain, pain in the arms, pain in the legs, and how to improve your overall quality of life through corrective chiropractic methods, as well as giving you some exercises and some tips. A particular patient came in about a year and a half ago. She was a teenager, about 15 years old at the time, and she came in complaining of neck pain and migraines at least once a week. That was it, neck pain and migraines that were bothering her. And we took a set of x-rays and we found that she had what's called a text neck. Well, before I go over that, I want to refresh what text neck is and what the normal curve should be. A normal cervical curve in the neck should have a nice curve. It should be nice and even throughout the bone. It should be nice and square, and the disc spaces should be nice and thick. So I can show you an actual image of one, right? So before I show you our patient's x-rays, let me show you what a normal cervical curve should look like. A normal cervical curve should be around 42 degrees ideally. And in this image, we can see a nice normal curve. We follow the green line, which represents the path of the posterior longitudinal ligament. And we see that the spaces, the bones are nice and thick, nice and square, and the spaces are even throughout, which represent the disc spaces. We know that the curve should be a part of a circle, and each segment should contribute evenly toward that arc. So it should not be straight in one section and all of a sudden a heavy curve on another. It should be a nice, evenly distributed curve. That's a normal cervical curve. So now let's look at our patient's neck. Now this was a year and a half ago when she presented with neck pain and migraines once a week. And you could see that the red line would represent the normal curve, and we can see that her neck has gone forward in typical fashion of what they call text neck. She's got forward head carriage, and the neck has straightened out. As I said, in this case, she had neck pain and she had migraines. The curve at this point measured 12 degrees, where normal, I said, ideally was 42. She was at 12, and she had 22 millimeters of forward head carriage. So this was her a year and a half ago. And she could not come in to commence care because of personal reasons. So then she came back recently, a year and a half later, a little over a year later, and I'm going to show you now what her neck looks like today. So this is our patient's neck today, and as you can see, she is now getting a buckling of her entire neck at the top. The first 1, 2, 3, 4 vertebrae are flexing forward in a kyphotic configuration, which is a buckling, and the bottom part of her neck still has somewhat of a curve left. So this is considered an S-shaped curve, which is much more difficult to take care of. It's going to take a much longer time to get her corrected. And with this configuration now of her neck, she's now presenting with numbness and tingling in both of her hands, along with the neck pain and headaches. So this is what happened to the neck in a year and a half. And if I pan back, I can show you the comparison between where she was and where she is today. So you can see on the left, she just has a straightening of her neck. It basically just straightened out on the top and moved forward. And in this view right here, you can see the entire upper cervical spine is starting to buckle forward, and her symptoms have now increased to, as I said, numbness and tingling in both of her hands, and she's only 16 years old. So if this does not correct it, the next stage would be arthritic changes in the neck, and then by the time she's in her 20s or 30s, possibility of herniated discs and many other problems. So this just goes to show you what can happen in a relatively short amount of time if these conditions, these text neck conditions, are not corrected manually. So you can take all the pills you want, you can take all the aspirin you want, which will relieve the pain. But as you're taking those pills, feeling better, your spine is starting to get worse and worse underneath the symptoms. Your spine is just buckling and getting worse. So a mechanical problem needs to have a mechanical solution, and that's what we do in corrective care. We take that spine and try to get it to its most ideal position where it belongs, to take pressure off of the spinal cord. And once again, this is our patient's neck on the right today in comparison to a textbook normal on the left. And as you can see on the right, you can see the buckling of the curve at the top, and you could certainly see the difference between this curve and the one on the left. Her neck at this point on the right could pass for somebody easily in their 30s or 40s, and she's only 15 or 16 years old now. Over again, why someone who loses the curve in their neck with text neck, for example, has these issues is because the spinal cord runs inside these joints here. There's a spinal canal, and the spinal cord runs inside this canal. And when there's a curve in your spine, let's say in your upper neck here, the spinal cord sits nice and slack. Once you start to lose the curve and your neck straightens out, we get what they call dural tension. So the spinal cord now has gone from a nice slack position to a tensed position. It's called tensile stress. And that dural tension causes a few things to happen. The first thing it does is it causes a decrease in conduction velocity. Research has shown that as your spinal cord gets tensed or gets stretched, the conduction velocity of the spinal cord itself, of the nervous system, decreases. And it also will irritate the nerve roots that come out of each segment, and these nerve roots will go down the arms and the shoulders, in the upper neck, and the low back. They go down to your legs. So if there's dural tension or stretching of the spinal cord, you're going to get the numbness and tingling that this patient is feeling. It could cause headaches, migraines, when the nerves that go up into the back of the head get irritated. So this is why it's so important to correct this alignment to get it back to its most ideal alignment possible for this patient. I hope you found this information in this video valuable, and if you know anyone that could benefit from this information, please pass the video on to them. Thank you for watching, and we'll see you in our next video. Valley Optimal Spine is located on 80 Broadway, Suite 1A in Cresskill, New Jersey. Our telephone number is 201-569-1212.